Hello to everybody. It is a real pleasure to introduce you in the new world of system-saving life. I'm Federico Semeraro. I am a consultant in anesthesia intensive care from Bologna, Italy. I'm very proud and happy to present you the System-Saving Life Guideline, a new baby from ERC. This is my conflict of interest. And this is my caption log. I will talk about concept, aim, and target group, topics, methodology, a concise guideline for clinical practice and public comment. This presentation this time is dedicated to the healthcare professional and patient that are fighting together against COVID-19. May the force be with you always. I'm very grateful to ERC committee to accept this amazing dream team as a writing group. So I'm very grateful to work together with these very nice friends. Thanks to Diana, Joyce, Teresa, Andrea, Andy, Bern, Freddy, Giuseppe, Joaquin, Kun, Marius, Roman, Sebastian, and Tino. A special thanks to Jerry and Gavin for a very amazing supervision. The System-Saving Life Guideline describes numerous and important factors that can globally improve the management of cardiac arrest patients, not as a single intervention, but as a system-level approach. The aim is to provide evidence-informed best practice guidance as a system in out-of-hospital and in-hospital cardiac arrest setting. The intended audience of these guidelines are government, manager of health and education systems, healthcare professionals, teachers, students, and lay people. The concept behind the system-saving life approach to cardiac arrest is to emphasize the connection between the different actors involved in the chain of survival. For example, citizens are involved through cardiac arrest awareness and may be engaged by apps as a first responder. The system-saving life concept emphasizes the interconnection between community and AMS and should be implemented in each European country. Several topics included, from the young students who learn CPR at school to a citizen who receives cardiac arrest alert through their mobile phone and is willing to start CPR and AD on the scene, to DMS that continues advanced treatment to stabilize and transport the patient for post-resuscitation care in a high-performance hospital. In system-saving life, everyone and everything is an important link to survival. We are moving from the classical 4-link chain of survival to a multitude of links in the new system-saving life concept. Every single step in this complex system is important. As a methodology, the source of evidence informing ERC guidelines are the ILCOR systematic review, scoping review, and evidence update. These were supplemented by a series of scoping rapid reviews conducted by ERC writing group. In addition, high-quality systematic review produced by other organizations were included where relevant. The ILCOR systematic reviews produce consensus on science and treatment recommendation based on grade methodology. ILCOR and ERC scoping review evidence updates were considered by the writing groups and recommendations were based on expert opinion. Everybody are familiar with the chain of survival and the formula of survival. The goal of saving more lives relies not only on solid and high-quality science, but also effective education of lay people and care professionals. If you can measure it, you cannot improve it. As Lord Kevin said, it is very important to measure. Based on systematic review, ILCOR recommends that organization or community that treat cardiac arrest should evaluate their performance and target key areas with the goal to improve performance. Social media and smartphone apps for engaging the community. Sci-fi technology become real. The future is here. In line with ILCOR, the ERC recommend the citizens who are close proximity to a suspected out-of-hospital cardiac arrest event and willing to be engaged, notified by the smartphone, should be notified. We believe that every European country have to implement this technology to improve the rate of bystander CPR to reduce the time to first compression and shock delivery and to improve survival with good neurological recovery. Thanks to Tommaso Squizzato for these nice infographics. ERC introduced European Restart Art Day in 2013. The European Restart Day now is World Restart Art. I'm very grateful to Mario, Bern and Andy for this event. From 2013 until now, this is a very great success of ERC. In Europe and all over the world, we need to be proud of all these people reached in the last 7 years through Europe with the support of every national resuscitation council and in the world with the collaboration of International Council and ILCOR. This is dedicated to the next generation of lifesaver. The kids are our future. Proud to support with Bird the Kids Save Life campaign in Europe and all over the world. This is another ERC success. The mantra is always the same. All school children aged 12 years and over should routinely receive up to 2 hours of CPR training each year. We need to push hard and fast on this area in the future with several innovative approaches to education and training. Unfortunately, COVID-19 recently affected Kids Save Life implementation, but we believe that kids learn much better than adults the new rules of the game for CPR training in the COVID area. We update also the European map of CPR education 2020. The map slowly become red and pink, and we are very proud of it. Nothing happens without the engagement of the community. Thanks to Andrea for this complete review about this challenging topic. We believe that community initiatives should be implemented in a large portion of the population to increase awareness. In the past, the guidelines of the ERC have been developed from a perspective of an ideal high resource and or high income environment. Little attention has been paid to applicability of statements from such areas in the daily practice of lower income region. In many parts of the world, a high resource standard of care is not available due to a lack of the financial resources. For example, low quality performance of EMS can be a barrier to guideline implementation. Internationally, valid recommendations should serve as a support structure for weaker system. For this reason, for this first time, was introduced resuscitation research in low resource setting. Thanks to Koen and Sebastian for this new approach and scoping review. In the context of system, an important reference are European Resuscitation Academy and Global Resuscitation Alliance, a very nice example of programs dedicated to implementation of the concept of system. It takes a system to save a life. It is a real nice motto. The role of dispatcher, it is a fundamental role. Teresa led this very important area of interest. Based on ILCOR systematic review, several new recommendations about dispatch assisted recognition of cardiac arrest, dispatch assisted CPR, the comparison of chest compression only compared with standard CPR, and another very important topic is the introduction of rapid response system to reduce the incidence of in-hospital cardiac arrest, the use of early warning score to track and trigger deterioration of the patient. Finally, bring all together the cardiac arrest competencies in one expert place. When possible, care for adult patients with non-traumatic out-of-hospital cardiac arrest in cardiac arrest center. That's all, folks. A very quick fly over rainbow of system saving life. These guidelines are open for public comment. Please give us your feedback on ERC website. And help us to share the concept of system saving life when posting some articles, photos, videos, or news related to system saving life. Use always system saving life hashtag everywhere. So, Keep the distance we must. May the force be with you, and live long and prosper. Thank you very much indeed.